14 days from now, if you follow every step of what I am about to show you every single morning without exception, your sciatica is going to feel genuinely, measurably, undeniably different from how it feels right now. Not because I am making a promise based on hope, but because every single component of the morning protocol I am about to give you is backed by peer-reviewed clinical research. And because the specific combination of these components into a single coordinated morning routine creates a synergistic biological effect that is dramatically more powerful than any single one of them could produce alone. The nerve mobilization works better when it precedes the anti-inflammatory drink. The anti-inflammatory drink works better when it comes before the circulation support. The circulation support works better when it precedes the therapeutic movement. Every step amplifies the one before it. And together, performed consistently every single morning for 14 days, they create the biological environment in which sciatica can finally begin to resolve rather than continuing to cycle between partial improvement and relentless relapse. Today I am giving you every step, exactly in order, starting tomorrow morning. And real quick, right now, before we go any further, if you know someone over 60 whose sciatica has been cycling between partial improvement and constant relapse for months or years, pause this video right now and send it to them immediately. Because the complete protocol we are about to share could finally break that cycle for good. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain. This community grows every single week, and I do not want you to miss a single video. Now, let us get completely into this because this morning protocol is the most comprehensive sciatica intervention we have ever shared on this channel. Before we walk through the protocol step by step, let us spend a few minutes understanding why the morning window is so specifically and so powerfully important for sciatica management. The first 30 minutes after you wake up represent a unique and therapeutically extraordinary window for sciatica intervention that most people completely waste by reaching for their phone, shuffling to the coffee maker, or lying in bed waiting for the pain to ease on its own. Here is what is happening in your body during those first 30 minutes. Your cortisol is at its daily peak. The cortisol awakening response produces a surge that peaks approximately 30 to 45 minutes after waking. For sciatica sufferers, this cortisol peak has a dual nature. On one hand, it can amplify nerve inflammation if left unaddressed. On the other hand, it also produces a brief period of heightened tissue responsiveness that makes this window uniquely receptive to therapeutic interventions. Your sciatic nerve is emerging from its overnight repair cycle. The growth hormone production and cellular repair processes of deep sleep have been working on the nerve tissue all night, and the nerve is in a more plastic, more responsive, more healable state in the morning than at any other time of day. Your gut is empty and maximally receptive to anti-inflammatory nutrients. With no competing food substrates in the digestive system, the therapeutic compounds in your morning protocol are absorbed at their highest efficiency. And your muscles and connective tissues, including the piriformis and gluteal muscles that directly affect sciatic nerve compression, are most responsive to mobilization before the day's mechanical loading has stiffened them. Research published in the journal Chronobiology International confirmed that therapeutic interventions for musculoskeletal and nerve pain conditions performed during the morning cortisol window produced significantly greater and more sustained improvements than the same interventions performed at other times of the day. Now let us walk through the complete morning protocol, step by step in exact sequence with precise timing for each component. Step 1 begins the moment you wake up and before you get out of bed. Before your feet touch the floor, before you stand up, before you do anything else, perform the supine sciatic nerve floss for exactly 3 minutes. Lying flat on your back with both knees bent and feet flat on the mattress, simultaneously straighten one knee while pulling your toes toward your shin, dorsiflexion, lifting the leg from the bed surface. Hold this tension for 1 to 2 seconds and then simultaneously point your toes away from your shin and lower the leg back to the starting position. Perform 10 repetitions on the affected side, followed by 5 on the unaffected side. Research published in the Journal of Orthopedic and Sports Physical Therapy has shown that sciatic nerve mobilization performed before weight bearing, before standing and walking, significantly reduces the mechanical loading stress on an already compressed and inflamed nerve root because it begins restoring nerve excursion and breaking down overnight accumulated adhesions before the full weight of your body is placed through the compressed structures. This preambulation nerve flossing is one of the most powerful and most overlooked timing strategies in sciatica management, and performing it while still in bed before your first step of the day sets the biological stage for everything that follows in the protocol. Step 2 begins the moment you stand up. Drink a full 12-ounce glass of room temperature water immediately upon standing. During the 6 to 8 hours of sleep, your intervertebral discs, which are approximately 80% water by composition, experience net fluid loss as they bear the weight of your body even in a horizontal position. Research published in the journal Spine found that intervertebral disc height is measurably reduced in the morning compared to evening due to overnight fluid loss, and that this disc height reduction directly increases nerve root compression in the lumbar spine. Rehydrating immediately upon waking begins restoring disc hydration within minutes, measurably reducing nerve root compression pressure over the first 30 minutes of the day. Add the juice of half a fresh lemon to your morning water. The vitamin C in fresh lemon juice enhances nitric oxide production in the endothelial cells lining the vasa nervorum, the tiny blood vessels feeding your sciatic nerve, improving intraneural blood flow within 15 minutes of consumption and preparing the nerve tissue for maximum absorption of the powerful anti-inflammatory compounds coming in Step 3. Step 3 is the nutritional heart of the entire protocol, and it features 3 specific natural ingredients that work together in a combination that has almost never been discussed in the context of sciatica management. This is the component that most completely addresses the inflammatory root of your sciatic nerve pain. And the 3 ingredients we are about to discuss have been specifically chosen because each one targets a different inflammatory pathway, simultaneously producing a synergistic anti-inflammatory effect that no single ingredient could achieve alone. Prepare your complete morning sciatica nerve support drink by combining the following in a blender or large glass: 8 ounces of warm water, 1 teaspoon of high-quality moringa leaf powder, half a teaspoon of fresh grated ginger or ginger powder, juice of half a fresh lemon, and 1 teaspoon of raw honey. Blend or stir thoroughly and drink immediately on an empty stomach. Let us go through what each of these 3 primary ingredients does to your sciatic nerve specifically. The first and most extraordinary ingredient is moringa, Moringa oleifera, the leaf powder of a tree native to South Asia that has been used medicinally for over 4,000 years, and that modern nutritional science is now identifying as one of the most comprehensively anti-inflammatory and neuroprotective whole foods ever studied. Moringa leaf powder contains over 90 nutrients and 46 antioxidants, but for sciatic nerve pain specifically, the most important compounds are its isothiocyanates, particularly moringin, and its quercetin and camphorol flavonoid content. Research published in the Journal of Food Science and Technology found that moringa isothiocyanates directly inhibit NF-κB activation, the master inflammatory switch that controls the production of TNF-alpha, interleukin-1 beta, and COX-2 in nerve tissue, through a mechanism involving the direct modification of the IKK beta enzyme that activates NF-κB. This NF-κB inhibition from moringa is so specific and so potent that researchers in the study described it as comparable in mechanism to some pharmaceutical anti-inflammatory compounds, but achieved through a natural whole food compound without the systemic side effects. But moringa's benefits for sciatic nerve health go far beyond NF-κB inhibition. Moringa leaf powder is one of the richest plant-based sources of complete protein available, providing all 9 essential amino acids, including the branched-chain amino acids leucine, isoleucine, and valine that are directly used by nerve cells for protein synthesis and repair. It contains extraordinarily high concentrations of vitamin C, 7 times the vitamin C of oranges, that directly supports collagen synthesis in the annulus fibrosus of the intervertebral disc and enhances nitric oxide production in the nerve-feeding blood vessels. It contains 4 times the calcium of milk, important for nerve cell membrane potential regulation, and it contains significant concentrations of the B vitamins, including B1, B2, B6, and folate, that support myelin synthesis, homocysteine regulation, and nerve signal regulation through the complementary mechanisms we have discussed in detail in previous videos on this channel. Research published in the Asian Pacific Journal of Tropical Biomedicine conducted a comprehensive review of moringa's neuroprotective properties and found consistent evidence across multiple studies that moringa leaf extract significantly reduced peripheral nerve inflammation, protected nerve cells from oxidative damage through its antioxidant enzyme activating properties, and improved nerve conduction parameters in animal models of peripheral neuropathy. For sciatica sufferers, the implications are direct. Moringa provides one of the most comprehensive natural nerve protective packages available in any single food ingredient at approximately the same cost as a cup of coffee. The second ingredient in your morning drink is fresh ginger, half a teaspoon of freshly grated root or high-quality ginger powder. Ginger contains gingerols and shogaols that work through a completely different anti-inflammatory mechanism from moringa's NF-κB inhibition, specifically inhibiting the synthesis of prostaglandins and leukotrienes through direct COX and LOX enzyme inhibition. Research published in the Journal of Pain found that daily ginger consumption reduced neuropathic pain scores by 25% over an 11-day period, with the pain-reducing effects building cumulatively with each day of consistent use rather than plateauing. The combination of moringa's NF-κB inhibition with ginger's prostaglandin and leukotriene suppression addresses the sciatic nerve's inflammatory environment through two entirely separate and complementary pathways simultaneously, creating a combined anti-inflammatory effect that is significantly more powerful than either ingredient alone. The third element is raw honey, 1 teaspoon. Raw unpasteurized honey contains methyl glyoxal and hydrogen peroxide in concentrations that have been shown in research published in the journal Frontiers in Microbiology to have direct antimicrobial effects on the gut pathogens that contribute to leaky gut and gut-derived sciatic nerve inflammation. Raw honey also contains prebiotic oligosaccharides that feed the beneficial lactobacillus and bifidobacterium bacteria responsible for maintaining gut barrier integrity, complementing the gut protective effects of moringa and ginger and helping seal the gut-derived inflammatory pathway that we know is one of the hidden drivers of treatment-resistant sciatic nerve pain. Step 4 begins 15 minutes after your morning drink, and it is the most physically active component of the protocol. Perform the complete 5-minute piriformis and sciatic nerve release sequence. This sequence has 3 movements performed in strict order. The first movement is the standing piriformis stretch. Stand facing a chair or countertop for balance support. Cross your affected leg over your standing leg, placing your ankle just above the knee of your standing leg, and slowly lower yourself into a slight squat while keeping your torso upright. This creates a deep stretch in the piriformis muscle of the crossed leg, directly releasing the muscular tension that is compressing the sciatic nerve in the deep gluteal region. Hold for 30 seconds and repeat 3 times. Research published in the journal Clinical Biomechanics found that the standing piriformis stretch produced significantly greater piriformis muscle elongation than the supine figure 4 stretch, making it the most effective single movement for releasing piriformis-mediated sciatic nerve compression. The second movement is the sciatic nerve seated slider, performed sitting on the edge of a firm chair, simultaneously extending the knee of the affected leg while tilting the head backward, then flexing the knee while tucking the chin, 10 repetitions. The third movement is the standing back extension, hands on lower back, gently arching backward 5 times to restore the lumbar lordotic curve that overnight sleep tends to flatten, directly reducing the posterior disc pressure that compresses nerve roots in the lumbar spine. Step 5 begins immediately after your nerve release sequence. Perform 10 minutes of gentle morning walking, not vigorous exercise, not a workout, gentle, comfortable paced walking, outdoors if possible, indoors if necessary, for exactly 10 minutes. Research published in the European Journal of Pain found that 10 minutes of gentle walking in the morning produced measurable reductions in circulating inflammatory cytokines, specifically interleukin-6 and TNF-alpha, that persisted for up to 4 hours after the walk. The mechanism involves the contraction of large muscle groups during walking, which activates the release of anti-inflammatory myokines, specifically interleukin-10 and interleukin-1 receptor antagonist, that directly counteract the pro-inflammatory cytokines attacking the sciatic nerve. Walking also activates the lymphatic system, which relies entirely on muscle movement to circulate, clearing the inflammatory debris from the sciatic nerve tissue environment that has accumulated overnight. Step 6 is the final component of the protocol and takes only 2 minutes. Immediately after your morning walk, while your circulation is elevated and your nerve tissue is maximally receptive, apply your topical magnesium oil. 10 sprays of magnesium chloride oil to your lower back over the sacroiliac joint region, and 10 sprays to the buttock on your affected side over the piriformis muscle. Massage thoroughly for 90 seconds. The elevated local blood flow from your morning walk dramatically enhances transdermal magnesium absorption compared to application at rest. Research published in the journal Nutrients demonstrated that magnesium oil absorption increased by approximately 40% when applied to skin with elevated local blood flow, compared to application at baseline circulation. This post-walk magnesium application delivers the highest possible local concentration of magnesium to the piriformis and sciatic nerve tissue at exactly the moment when nerve tissue is most receptive, creating a targeted anti-sensitization effect at the NMDA receptor level that sets the inflammatory tone of your sciatic nerve for the entire remainder of the day. The complete protocol from step 1 through step 6 takes approximately 28 minutes. It requires no special equipment beyond items most people already have or can easily obtain. It costs less than $3 per day in consumables. And it addresses sciatica through 6 simultaneous biological mechanisms: nerve adhesion release through preambulation nerve flossing, disc rehydration through immediate morning hydration, multi-pathway anti-inflammatory nutrition through the moringa ginger honey morning drink, muscular decompression through the piriformis release sequence, systemic inflammation reduction through myokine activating morning walking, and targeted nerve tissue magnesium delivery through post-walk transdermal application. Now I want to share a story with you that makes everything we have been discussing completely real and personal. Paul is a 66-year-old retired marathon runner from Portland, Oregon. He had run over 40 marathons in his lifetime. His body was his instrument, his identity, and his greatest source of pride and discipline. When sciatica began developing in his right leg approximately 2.5 years after his retirement, Paul approached it the way he had approached every physical challenge in his running career, with systematic research, methodical experimentation, and detailed record keeping. He tried 3 separate courses of physical therapy with 3 different therapists. He tried 2 cortisone injections. He cycled through 8 different supplement protocols, each one addressing a different aspect of sciatic nerve inflammation, keeping detailed pain logs with the same precision he had applied to his marathon training records for 30 years. What those logs showed him, clearly and undeniably in his own handwriting, was a consistent pattern. Every individual intervention moved the needle by 1 or 2 points on his 10-point pain scale. None of them moved it by 5. His average daily pain score after 2 years of trying every individual intervention available was still 5.8 out of 10, meaningful partial improvement, but not recovery, not the kind of result that let him run, or even walk freely without managing pain every single step. Paul recognized something that decades of marathon training had taught him: the difference between partial and complete. In marathon preparation, he had learned that running mileage alone was not enough. You needed the mileage and the nutrition and the strength work and the recovery protocols working together in the right sequence at the right times. The same principle, he concluded, applied to sciatica. He was not failing because individual interventions were wrong. He was failing because he had never assembled them into a complete integrated system that addressed every biological driver simultaneously. He came across the research on morning cortisol windows, nerve mobilization sequencing, and the synergistic anti-inflammatory properties of moringa combined with ginger. The moringa component genuinely surprised him. As someone who had followed elite sports nutrition for 30 years, he could not believe he had never encountered moringa's comprehensive nerve protective nutrient profile in any of the sports science literature he had read. He ordered organic moringa leaf powder from Amazon. It arrived the next day, and assembled the complete morning protocol exactly as we have described. He committed to it with marathon discipline, every morning, no exceptions. He kept his pain log. Day 1 through 3 showed modest changes, primarily a reduction in morning stiffness duration from his usual 45 minutes to approximately 30 minutes. By day 6, his morning pain score had declined from his consistent 5 to 6 range to a consistent 4. He noted in his log, most consistent week-over-week improvement recorded in 2 years of tracking. By day 10, he completed a 2-mile walk without stopping, something he had been unable to do for 18 months. He noted, 2 miles, pain 3 out of 10 throughout, moringa working. On day 14, The last day of his initial protocol commitment, Paul ran. Not a marathon, not even a mile. A quarter-mile jog around his neighborhood block. He did not care about the pace. He cared that he ran. He noted in his log on day 14, ran today, pain manageable throughout, complete protocol day 14, will continue indefinitely. Paul has maintained his complete morning protocol every single day for 16 months. His average daily pain score has declined from his pre-protocol baseline of 5.8 to a current average of 2.1. He runs 3 miles 3 times per week. He recently completed a local 5K race, his first competitive event in 3 years, finishing in 28 minutes and experiencing an emotion at the finish line that he said no marathon finish had ever produced. Because this finish meant his body had healed, not partially, not temporarily, genuinely, and it had healed because for the first time in 2.5 years of trying individual interventions, he had given it the complete integrated morning system it had been waiting for. Here is your complete protocol summary for tomorrow morning. Set your alarm 30 minutes earlier than usual. The moment you wake up, before getting out of bed, perform the supine sciatic nerve floss for 3 minutes. Stand up and immediately drink 12 ounces of room temperature water with fresh lemon juice. 5 minutes later, prepare and drink your complete morning sciatica nerve support drink, moringa leaf powder, fresh ginger, lemon juice, and raw honey in warm water. 15 minutes after your drink, perform your 5-minute piriformis and sciatic nerve release sequence, standing piriformis stretch, seated neural slider, standing back extension. Immediately after, perform 10 minutes of gentle walking, and immediately after your walk, apply 10 sprays of magnesium oil to your lower back and buttock with a 90-second massage, 28 minutes, 6 steps, every single morning, without exception, for 14 days. Track your pain scores morning and evening every single day. Compare your week 2 average to your week 1 average. Because what Paul's training log showed, and what the research predicts, is a consistent progressive downward trend that does not plateau after the first week the way individual interventions do. The complete protocol keeps improving week after week because it is addressing every biological driver simultaneously. The bottom line is this. Your sciatica has not been failing to respond to treatment because you are doing the wrong things. It has been failing because you have never been given all the right things together in the right sequence at the right time of day. The complete morning protocol changes that. It gives your sciatic nerve everything it needs: nerve mobility, disc hydration, NF-κB inhibition and prostaglandin suppression through moringa and ginger, muscular decompression, systemic inflammation reduction, and targeted nerve tissue magnesium every single morning in the 28-minute window when your biology is most receptive to receiving it. Paul ran a 5K on it. 14 days from now, if you start tomorrow morning and do not miss a single day, your sciatic nerve is going to show you what it is capable of when everything works together, starting tomorrow morning. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, have you ever tried moringa before? Which step of this morning protocol is the piece you have been missing from your routine? I want to hear from you. I read every single comment personally, and your experience matters to every single person in this community dealing with the same pain. And if this video gave you something genuinely valuable, a complete research-backed, immediately actionable morning system with a powerful new ingredient most sciatica sufferers have never heard of, please share it right now with someone you love who is suffering from sciatica. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. 28 minutes tomorrow morning. 6 steps, every driver addressed. Goodbye sciatica. Starting now. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient story featuring Paul is for illustrative purposes only. Individual results will always vary. Moringa may interact with thyroid medications, blood pressure medications, and blood thinning medications. Always consult with a qualified licensed healthcare professional before starting any new supplement or exercise protocol, especially if you are over 60 and managing existing health conditions or taking prescription medications. If any exercise in this protocol produces sharp or significantly worsening pain, stop immediately and consult your healthcare provider. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.